Hello and welcome to our podcast, It Didn't Start Here, where we shine a light on public health issues affecting the city of Chicago. Today, we're having a real conversation about opioid addiction, how it starts, how it spreads, and what we can do to prevent it. Our names are Zuli and Elijah, and we are grad students at Southern Illinois University and the Masters of Public Health program. Opioid addiction doesn't just happen. For many adults, it starts in a doctor's office with a prescription. It often seems innocent at first after surgery, a sports injury, or dental work. But over time, these prescriptions can spiral into something much more dangerous.
Now we would get into segment 1 on how it starts. Opioids are powerful painkillers. Medications like oxycodone, hydrocodone, and morphine are commonly prescribed to manage pain. But when overprescribed or misused, they can lead to physical dependency and addiction. In Chicago, just like many other cities, we have seen many people move from pills to street drugs like heroin, fentanyl, and meth or cocaine, not because they wanted to, but because they ran out of legal access or they were still in pain. Here's the thing, opioid addiction affects everyone, even men and women, black or white, young adults or older people. It doesn't matter where you live, it is happening right now in our city core, in our neighborhoods every day.
The second part of our podcast, we want to talk about levels of prevention and how this applies to opioid addiction. So for primary prevention, which means stopping addiction before it starts, what that looks like is educating doctors and patients on the risk of opioids. In Chicago, we need to push for safer pain management using alternative things such like physical therapy, counseling, acupuncture, or non-opioid medications. We also need more community outreach in schools, clinics, and even barbershops to talk about addiction before it begins. Secondary level of prevention is where we catch things early. For people already misusing opioids or who are at higher risk, we need fast access to tools like Narcan, also known as Naloxone. This is a life-saving drug that can reverse overdoses and save lives. We need Narcan in community centers, libraries, and CTA stations, and we need people to teach how to use it. Narcan training in neighborhoods like Inglewood, Lawndale, and Pilsen can save lives. You might be asking yourself, well, what does an overdose look like? So these are the signs of an overdose. When you see someone and they don't respond when you call their name, if they have slow breathing or not breathing at all, if their lips and fingernails turn blue or gray, if their skin is pale or clammy, if they have either a slow pulse or no pulse at all, and if their pupils are constricted or very, very small. If you see any of these signs in a person who may be using opioids, please call 911 and give Narcan. If there's no reaction after 3 minutes, you can give a second dose of Narcan. If after the second dose there's still no reactions and you are trained or know CPR, please do rescue breathing and or chest compressions. Otherwise, wait for 911 to come and for the emergency medical services to arrive. Now we will continue with tertiary prevention. Tertiary prevention is helping people who are already battle with addiction. That means connecting them with treatment centers and peer support groups. There are programs in Chicago, like the Haymarket Center and Chicago Recovery Alliance, that offer services, but we need more of them, and they need to be accessible. Addiction does not end with one treatment. People need ongoing support to recover and rebuild.
Now, let's get into segment 3. What can we actually do as a community? First, we have to stop judging. Addiction is a medical condition, not a character flaw. Second, we need to talk about it with our families, our doctors, and our friends. Third, support Narcan access. Advocate for more funding, more education, and more compassion. Everyone can be part of the solution, whether it's checking on someone, sharing resources, or just being there. Here are opioid use for this opioid use disorder treatments, outpatient programs as well. First, intensive outpatient program, which is typically 9 hours of service per week. Outpatient program that's typically 2 to 8 hours of service per week. Also, there are residential programs where there are different types of residential services that offer most intensive full-day programming. There is another program where it's medically monitored detoxification. Typically, it lasts a 3 to 7 day in-state patient stays when an individual receives medication to help with symptoms of withdrawal. There are 3 medications that can be approved to be used in the treatment of opioid use disorder. First one is methadone. Methadone can be prescribed for opioid use disorder treatment with specialized programs called opioid treatment programs. Methadone works by reducing cravings for opioids. Research has shown that many people who receive methadone treatment live longer and are more likely to engage in treatment and less likely to use opioids or die from an overdose, have legal problems, or contract HIV or hepatitis C, compared with those who engage in treatment but do not use methadone. The second medication is Sudafedone. Works in a similar way as methadone, and in that it reduces cravings. Sinoxidone can be prescribed by most physicians, nurse practitioners, physician assistants. Third, naltrexone works differently than methadone or sinoxidone. It is typically offered as an injection that lasts for 28 days. During those 28 days, it actually blocks all opioid receptors in the brain. When opioid receptors are blocked and using opioids, such as heroin or prescription opioids, does not lead any positive effects. There's no feeling of being high. Thanks for tuning in to It Didn't Start Here. If there's one thing we hope you remember, it's this. Addiction can begin in the doctor's office, but it doesn't end in tragedy. Through education, action, and compassion, we can fight back.
We also wanted to add that there are many resources for you to seek help. If you are unaware of clinic locations or treatment centers near you, you can go to chicagoconnects.org or 211metrochicago.org. Enter your zip code, and it will give you a list of different locations and treatment centers that accept those with insurance, without insurance, or if you're underinsured. Getting help should not be hard, or it should not be based on your income or your insurance. There are grants and programs in the state of Illinois that offer help to pay for the cost of getting treatment. Seek help if you feel that you need it.
Until next time, stay aware, stay connected, and take care of each other. Oh, wait, don't forget to check out our blog for more information and local resources. We also have a TV commercial and a PSA to learn how to spot the early signs of opioid misuse. Everything is a part of our mission to inform, uplift, and protect our community. One voice at a time. Whether you're listening on your way to work or winding down for the night, thank you for spending your time with us. Talk to you all soon.